Hi, Dr. Saxena here, and I just want to talk about something about toxicity only. And what happens is when we talk about toxicity, we tend to miss out some things which are told to be harmless to humans. Yes, I am talking. I'll be talking about something on GMO foods and all that. What is this particular thing has to do? What is this glyphosate? And how it is disrupting gut bacteria and causing well, see, this is there are big things which has happened post glyphosate. So whatever has been told to us regarding this, whatever Monsanto has told, that glyphosate is harmless to humans because our cells doesn't have that shikimate pathway. But what I we understand is our gut bacteria, which are usually symbiotic, and they try to give us a lot of things. The existence of this microbiome and the gut bacteria, because this helps them. We depend on them as they depend on us. We also depend on them or to supply to because they supply the essential amino acids produced to them, their pathway. And usually many other nutrients as well as short chain fatty acids are usually that is being we depend supply from them. So what happens is that because of this toxic effects of this glyphosate, all this get bacteria get depleted, we are into big problems. And certainly the post lawsuits about Hodgkin's lymphoma, people, there are non-Hodgkin's lymphoma, there are 2 3 lawsuits which has gone for in this glyphosate, due to glyphosate toxicity, has produced a lot of public awareness, and we believe you should know what is this thing what this doctor is talking about. GMO are basically Roundup things, ready corn, soya, sugar beets, cotton, tobacco, and these are all things which have been we are talking about. And we somewhere I believe there is something like it is being Roundup is sprayed as a desiccant, and this particular thing on the we harvest, before the harvest, it's a wheat, oats, barley, rye, sugarcane, beans, lentils. All these things have been sprayed with this desiccant, which is a ripener, as used as a Roundup. And so this particular thing is has led into some problems, which is something like used as a herbicide. And this thing has led into sharp problems relating to something like this thing. This is very toxic to your gut bacteria, and the whole gut bacteria gets depleted with this. And yes, we were apart from that, we found that there was one more thing. Glyphosate use is a it's a good endocrine disruptor. And see, here the low levels are more toxic than the higher levels. So there are a lot of studies which have been coming up, and we are seeing the likes of Stephanie Sinef, which have been following her, and it is something like a big thing for us, trying to understand what is this thing called shikimate pathway and all that. It's because of her only I'm able to understand all this stuff. And based on that, how this glyphosate disrupts the gut microbiome. And what we need to understand is this problem is a real problem, and we need to work it out by just this is the way when this glyphosate it disrupts the shikimate pathway and the glyph thing, so that whatever gut microbes through this corismate, they form that vitamin K, vitamin B, neurotransmitters, and all that. Now we see a big deficiency of vitamin K, causing a lot of, I get a lot of cases with arterial calcifications, and I know this is because of vitamin K deficiency. So thing is, I need to be, we need to work it out by trying to preserve this shikimate pathway for the gut microbes, so that they can always serve as normal vitamin B, K2, all B vitamins. Apart from that, thyroid hormone and all. It's a big take when we talk about this particular thing. And there are toxic effects of glyphosate, and this apart from that, it interferes with the cytochrome P450 enzymes in liver, and these are the things which are necessary for breakdown of detoxifying many chemicals. So with this glyphosate, you are in for a lot of problems, like you are interfering the amino acid formation, disrupting the sulfate synthesis and sulfate transport. It's a big thing. I can always tell you the low levels of vitamin D, which is now a very prevalent, and you know what low levels of vitamin D means in this pandemic thing. It's like certainly it is because of this glyphosate we are into this low levels of vitamin D, and you have to see that this glyphosate also chelates all the good things like manganese, zinc, and all, which makes, so once it takes out this, so zinc deficiency is a one bigger thing which is coming into a existence, and we are seeing a lot of problems because of the zinc deficiency. So having said that, I would like to tell about what are the areas glyphosate applications to corn, soy, and soy, cotton, and this resistant disease and all that. So this particular thing has been used, and it has the thing is absolutely this has gone up manifold. The thing which happens with this glyphosate is it accumulates in the biofilms, and biofilms are one thing which we should always look into that, and we try to understand things. And I just want to give an idea. This is the mucousy slime layer which is in the intestinal tract. About that, which slimy layer doesn't allow any kind of toxic things to enter. So once these biofilms are corrupted, there is no good mucosal barrier. That is the major thing we have to be careful about. And this is where there are a lot of other studies talking about glyphosate damage. It's a big kind of thing, and I would like to not go much deeper into that, but I can always tell you there are a lot of human and animal diseases which are resulting because of this excessive usage of this glyphosate. And I can always tell you there are correlations of human diseases and all. There is a correlation between rise in glyphosate usage and the rise in multiple health issues in newborn. So this data and all that are really a kind of thing for us, and we are seeing this kind of congenital heart conditions in the newborns and enlarged right ventricle in the adults. This is going on a high time rise. Probably it is because of this is the paper what I can always tell you, which glyphosate based herbicides potentially affect the cardiovascular system. Is all this time I was just thinking it's the lead toxicity, it's the kind of other things which are causing heart disease, but glyphosate causing heart disease, it was new for me. And there are big things which can happen if the still society starts depending on the glyphosate use of the wheat, corn, and soya. And you can see increase in newborn genital disorders like hypospadias, hydrocele, or kind of undescended testis and all that. They are increasing in number. And the most important thing what I as a thing, I have seen a lot of epidemic of fatty liver. And as a radiologist, I used to think that it's only found in diabetics and all. It is not so. See the healthy liver and the fatty liver. This is we used to think fatty liver is because of alcohol, and no, it is just not alcohol. Definitely causes fatty liver. There are a lot of other chemicals which cause fatty liver. All this ethers and all that. But apart from that, you have something like to worry is non-alcoholic fatty liver disease in rats following exposure to that low levels of Roundup herbicide. So glyphosate correlated with fatty disease in the human. This is the recent study of 2018, and I still I think this is much thing. And the other important thing what I want to tell you is about the kidney disease, which is something like CKDs, which are very common in kidney failures are very common in agriculture workers. We have in Andhra Pradesh, there is a place called Uddanam, and there is in Srikakulam district, and where people about 25 years, all of them they are having. So something has to be attributed to glyphosate, as seen in something like Sri Lanka, where they banned this particular thing, and paraquat. So once after banning that, they were able to see there is a decrease in levels of kidney failure in that group areas. So again, acute kidney disease death rate with glyphosate, we have seen a statistically significant thing here in the US also. So this thing which I just want to convey is this is a simple thing. Take, and if you can understand what this glyphosate spikes chronic kidney disease fivefold, which was described in Sri Lanka. I think this thing has to be worked out here. Not just CKD, I see a rise in autism, I see a rise in ADHD, schizophrenia, anxiety, sleep disorder. All this can be related with this glyphosate, as well as some other things. So for me, glyphosate is not just a simple thing which is causing only shikimate pathway doesn't occur in humans, but what we are dependent on the shikimate pathway of our beneficial bacteria. That is the reason we should always look into all these things. And we have seen excessive problems of renal disease, we have seen celiac disease, we have seen inflammatory bowel diseases, autism, ADHD, cancers. All this can be contributed. See, this one of the paper which showed glyphosate, celiac disease, and non-Hodgkin's lymphoma because of this particular stuff. And this is something which we always have to look into that. I've been advocate of trying to work out what is this toxicity, and if we know what is this toxicity, we can always go ahead with trying to work it out. So for me, like glyphosate is one of the big things, and some years before I was not aware about this word called glyphosate, and now but indirectly we used to avoid. We used to tell that okay, you don't take corn, you don't take soy, you don't take wheat for all our patients, and it worked. I was not aware about that. This are all the kind of crops this particular thing is. So see, you need to, and I was not aware vitamin D resistance or vitamin D reductions in the population are because of this glyphosate. And yes, I'd certainly like to now we know there is a problem. We can always work it out hand in hand, and this is the way we try to put it, detox protocol for this glyphosate. It's quite simple, and I can always tell you it takes at least 6 to 12 weeks for people to get out. See that glyphosate, whatever is being inside your human system, in the sense it gets into the fat also. So you need to properly devise a protocol. At the same time, we have some protocols trying to work with this glyphosate, how we can work it out. But I can always tell you, once you deal with this glyphosate, your endocrine disruption, your so many things will be kitted in a proper way. That's it for glyphosate today. Thank you.